Hi, Dr. Mike Ferguson. I thank you for watching this quick video. I just had to take a minute to share with you something that is so exciting to me and what potentially could happen across our nation. This is Tuesday, January the 13th. It is the eve before, to me, an incredible, groundbreaking time that tomorrow morning at 10 o'clock, Wednesday, January the 14th, I have the opportunity, in partnership with Evangel University, their church ministries department, Chris Magoo, and the youth ministries department, to be able to take seniors who are youth ministry majors. They'll be graduating this coming May, going out into the ministry to start full-time youth ministry or lay youth ministry, and begin their walk with their calling, with their churches, and be able to take them for an entire semester and talk to them about how to begin to minister to students who are going through crisis, who are going through suicidal ideation, who are facing mental illness, who are facing all kinds of trauma. And I'm excited. This is an amazing time, and I appreciate so much Chris Magoo and the leadership of the Church Ministries Department who have caught a vision to train potential youth ministers who will be graduating college to walk into their ministry locations with the tools to be able to minister to students who, as one of our books says, ministering to kids who don't necessarily fit. Some of the things we're going to be talking about are the signs and symptoms of teens facing crisis, mental illness, or suicide. And we're going to be looking at different types of crises. We're going to talk about bullying, cutting, self-harm, death, divorce, crisis with pregnancy in teens, the aftermath of school violence, sexual abuse, sexual identity confusion, when crisis happens there. We'll talk about dropping out. We're going to look at the difference between typical adolescent development and teen development who's developing a mental illness. We'll be looking at many of the mental illness signs and symptoms of anxiety disorder, eating disorder, substance abuse, depression, post-traumatic stress disorder, bipolar, schizophrenia. We'll be looking at suicide prevention, doing it in person, doing it by phone, doing it online. We're going to be putting into the hands of our students all the things they need to prepare them to become youth pastors who are really able to minister to kids who don't fit. We're going to be walking through this, helping teens in crisis. We're going to be certifying them as youth mental health first aid instructors and leaders. We're going to be talking about QPR, which is the suicide prevention. We're going to go through trauma-informed crisis intervention. We're going to talk to them how to stop a student from suicide. So this is, to me, an exciting eve. I've just finished the first session, and we're looking forward to every Wednesday morning at 10 o'clock at Evangel University, taking these senior youth ministry majors and preparing them to walk out in May after their graduation into their ministry locations equipped to minister to students who are facing crisis and all kinds of things. So I covet your prayers, and I look forward to reporting back to you what's going to be happening over this semester. And I just want to thank the leadership of the Church Ministries Department at Evangel for having such a vision to do this, and we pray God will use these youth ministers, youth pastors, in a tremendous way. So keep up. We'll let you know what's going on as time progresses. Thanks, and have a wonderful afternoon, evening, or morning.